I'm Justin, this is Aaron, and this presentation is going to be about treatment and rehabilitation on an ACL in the knee. First slide is just it's just a quick picture of what I'm going to be talking about. So here's the posterior, and here is the anterior, which is what we're going to talk about in this presentation. It's an ACL, which stands for anterior cruciate ligament, is an injury that lies deep within the knee joint. It's one of 4 stabilizing joints that is in the knee. Others include PCL, MCL, and LCL, which is posterior cruciate ligament, medial cruciate ligament, and lateral cruciate ligament. A complete ACL rupture is a common injury that happens in most contact sports, for example, football, rugby. It's caused by twisting or force that's been applied to the knee whilst foot is firmly on the ground. Like, for example, if you're playing football and your foot gets stuck in the ground and you try and turn, your knee is more likely to twist. And other causes include direct blow to the knee. So,
the treatment that that would help for ACL would be immediately stopping physical activity due to your injury, due to your injury. Apply RICE, which is rest, eye compression, and elevation.
As soon as that's done, seek medical attention straight away. Refer to a doctor or specialist, which then they will assess the knee and also ask how the injury occurred. You will then be sent to a hospital for an MRI or X-ray to confirm if it's actually a complete rupture that's happened. They then may refer you to a surgeon if required. Protect the knee by wearing knee support.
Rehabilitation. After you've had surgery and you have to attend rehabilitation session. It's a long process that involves an athlete getting back to peak fitness. The doctor will then will allocate you a little program you have to do while coming to rehabilitation.
I will now break down the rehabilitation program into different stages. Stage 1, this step is known as early rehabilitation. This covers short-term goals such as reducing swelling whilst trying to gain movement. Then we go on to phase 2, and this phase covers over 3 to 4 weeks, and this is when the patient should start trying things that his knee is not willing to perform. Patients should do exercises such as riding stationary bikes that you see in a gym, and the aim of this is to be able to bend the knee to at least 100 degrees, if possible.
Phase 3 is similar to phase 2, and exercises are the same but more challenging, so you'll increase the intensity a bit. The patient will then try and bend their knee 130 degrees, and this stage is focused heavily on improving your balance, where you can go on a ball to balance the injured knee.
Or trying to stand on one leg to help improve. Phase 4, this week covers between weeks 6 to 8, and in this stage the patient will focus mainly on trying to maintain a full range of motion, as well as increasing resistance for workouts, like for example doing squats, trying to build up the strength in their knee, trying to get it back to full fitness.
Phase 5 is a light activity phase, and it covers more weeks. This will then focus on strengthening exercises whilst also concentrating on mobility and your balance.
As I said before, the balance, just trying to stand on one leg for a certain amount of seconds and then keep trying to improve it over the weeks, see if your knee can withstand. Final phase is phase 6. This phase lasts from 10 weeks and beyond, and it will go on for as long as until the activity level has been reached. The patient will start light jogging and perform like agility drills, like just quickly running or jogging and trying to turn as fast as they can. And then once that's done, a surgeon may perform tests between 3 to 6 months to monitor the athlete's activity level. Once then done, the surgeon will decide whether he thinks the athlete has reached his goal and got back to full fitness within the length of time that was stated at the beginning.
Okay, any questions? Just a quick one. So when you're doing squats and stuff, they're designed to strengthen the knee, is it?
I was hoping, but maybe it said strengthening exercises, so I thought doing a squat, well,
Okay.
back squats might help improve strength.
Where in the leg? What muscles does the leg do squats
That
work?
would do thighs and quads and whatnot, yeah.
Okay, so by strengthening those muscles, will it help the knee?
No.
Oh, you lied to me.
Would it?
I'm not too sure to be honest. I'm not really.
What might help strengthening the muscles around the knee? What might that help do?
Stabilize.
Yeah, keep help with mobilization and balance and whatnot.
Okay, yeah. Okay, thank you.